Welcome back to Cureus Conversations. Our interview today is the first one in our new series on AI in medicine. Today we have with us Dr. Katsuki. Hi, how are you doing today?
Thank you very much to invite me. Yeah, I know, I'm fine.
Yes, well, thank you so much for joining us. So, for our first question, could you give me a brief overview of your background or your pathway to your current position?
Oh, okay, thank you. I have been a neurosurgeon for 8 years, specializing in the diagnosis and treatment of stroke and headache disorders. Concurrently with my medical career, I have been pursuing studying in the field of AI and statistics. During my clinical work, I became fascinated by the vast amount of data generated in healthcare and untapped potential it held. This led me to delve into the field of data science and pursue further education in that area. I completed additional coursework and training in statistics, machine learning, and programming. Eventually, I combined my medical knowledge with my newfound data science skills and ventured into research where I could apply advanced analytics techniques to healthcare data. Currently, I hold a position as a doctor and data scientist, allowing me to bridge the gap between the medicine and data-driven research. Right now, I'm mainly developing prognostic and predictive models for stroke and diagnostic models for headache. Regarding the headache diagnostic model, we are about to start a clinical trial in Japan as a medical device.
Wow, well, congratulations. That's amazing. So going forward, I wanted to ask a few questions about your new paper that you've authored in Curious. With this paper, which is titled Easily Created Prediction Model Using Automated Artificial Intelligence Frameworks, I wanted to ask what drew you to this subject? What sparked your interest in the applications of AI and its applications to medicine?
Okay, in a country like Japan, where healthcare resources are limited, it is crucial to prevent patients from becoming bedridden. So, subarachnoid hemorrhage, for instance, is a life-threatening condition with a survival rate of only 1 in 3 patients without treatment. However, even with treatment, if the patient ends up bedridden, it may not bring happiness to their family. Therefore, it is essential to have through a thorough discussions with the patient's family regarding the decision to pursue treatment, considering the potential outcomes. Predicting the patient's prognosis becomes a vital aspect of this process. Unfortunately, traditional statistical models have had limited accuracy in making such predictions. To address this challenge, we developed an AI system using our hospital dataset, which significantly improved the accuracy of outcome predictions. With such AI-driven prognostic capabilities, we can potentially provide personalized medical care based on the predicted outcomes. By leveraging AI in outcome prediction, we aim to offer individualized healthcare decisions that optimize patient and family well-being. Our approach empowers families to make informed choice regarding treatment, considering not only survival, but also the quality of life after treatment. Ultimately, our goal is to improve patient-centered care and contribute to the well-being of both patients and their families in the face of limited healthcare resources.
Wow, that's so interesting. So it seems like a really nice framework for essentially diagnosing and crafting the best treatment plan for these patients, which is quite revolutionary, really. So, given that, could you kind of walk us through your paper?
Okay, we analyzed a data set of 300 patients with subarachnoid hemorrhage who underwent coiling treatment. The aim was to predict a favorable functional outcome at 6 months using an AI model. The dataset was split into a training set and test set. The AI model achieved a high predictive performance with an AUC of almost 100% for the training set and about 80% for the test set. Compared to the previous statistical models, the AI-based approach showed superior performance in predicting functional outcomes. that highlights the potential of AI in improving prognostic accuracy and enhancing patient care in subarachnoid hemorrhage treatment.
What do you think the implications of the study are?
I believe that treatment decision and prediction of patients' longevity and prognosis will become more and more accurate, and we will be able to propose more personalized medical care. Although only tabular data was used in this study, the prediction accuracy will be further enhanced if image data and biological monitoring, such as heart rate, are also used.
Given this, what work do you have planned for the future?
Currently, we focused on headache treatment rather than stroke, and we are developing an automated headache diagnosis model. In any field, I believe that with big data, it is possible to create AI and create a reliable partner for everyday medical care. I hope that we can conduct joint research in various fields and make society more convenient.
Fantastic. Well, convenient and safer and healthier, it seems, is going to be the outcome. Well, let's go ahead and pivot away from some of your research-related questions to a more personal question. So, who in your career so far has influenced you the most personally and otherwise?
So one of my biggest inspirations, both personally and otherwise, comes from the realm of literature. While some may not be familiar with it, I have a deep appreciation for modern Japanese literature, particularly during the Meiji era, when Japan experienced a rapid transformation and modernization. Writers such as Natsume Soseki and Mori Ogai hold a special place in my heart. The reason for my admiration lies in the fact that their works beautifully capture the conflicts and passions of individuals during a time when traditional customs and culture were being influenced and reshaped by the emergence of new civilization. It was a period of immense change and cultural transition. Similarly, with the advent of AI, we are currently experiencing a dramatic era of transformation where the world is rapidly evolving. I can't help but feel a similar sense of passion and conflict in this dynamic time. The profound influence of literature, particularly the works of authors from the Meiji era, has shaped my perspective on the power of storytelling and its ability to reflect the essence of human experience in times of upheaval and societal change. It has inspired me to explore the intersections of literature, technology, and human emotions, and to harness the potential of AI to navigate and make sense of this rapidly changing world.
Wow, very, very well said. It's truly inspiring how you connected the Meiji era literature to our current status quo of change in research and your own work as well. So thank you so much for sharing your thoughts with us today on Curious Conversations. We truly appreciate it.
Thank, yeah, thank you very much.